Host. What if most health answers from ChatGPT come from sources you can't easily verify? The credibility of AI health advice now hinges on signals you can actually check. Guest, welcome to the Authority Signals podcast, where we unpack a study that turns the messy web of sources into 4 simple questions. Host, it's called Authority Signals in AI Cited Health Sources, a framework for evaluating source credibility in ChatGPT responses. Guest, think of it like a hygiene checklist for information, or a recipe with 4 ingredients that make the dish trustworthy. Host, first, who wrote it? Author credentials. Guest, the study asks us to check the author's credentials, because a medical degree or a public health background matters. Host, second, who published it? Institutional affiliation. Guest, is the author linked to Mayo Clinic, a university, a health agency, or another reputable institution? Affiliation signals norms and oversight. Third, how is it vetted? Quality assurance. This is the vetting process. Peer review, editorial standards, transparency about methods. It's like getting a stamp of quality before something goes public. Host. Fourth, how does AI find it? Digital authority. This is about how sources surface in search systems and AI training data. It's the digital fingerprint that helps AI retrieve credible material. Host. The researchers fed 100 HealthSearchQA questions into ChatGPT 5.2 Pro and scored 615 cited sources against this framework. Guest, they found over 75% of cited sources came from established institutional sources like Mayo Clinic, Cleveland Clinic, PubMed, NHS, and yes, even Wikipedia, with other sources lacking solid backing. Host, so what does this mean for you, the listener? Guest, it means when you ask AI about health, you should ask for the sources, check the author, check the institution, demand quality assurance, and understand how the AI found the answer. Host, if you're building or consuming AI health tools, apply authority signals as a checklist before trust. Guest, and if you're curious to dive deeper, read the paper, follow the authors, and share this framework with friends. Host, in a world where millions of AI health answers circulate weekly, authority signals is your compass. Guest, exactly, and we've got more coming up on how to use this in daily health questions, so stay tuned. Subscribe for more insights. Rate if you found this helpful. Drop a comment with your biggest source credibility question, and tell us which signal matters most to you.